Good morning. My name is John Green with Association Member Benefits Advisors. It's 10:30 and welcome to the MRTA scheduled long-term care conversation, part of the MRTA educational series. Good morning, Jim. How are you, sir?
Good morning. I am fine. Sun is shining.
Well, that's good. I'm coming up there tomorrow, so hope you hold the rain off for me for just a little bit. So
okay, I will do that.
I appreciate that. My name is John Green. I'm joined by co-host Bo Carr, as well as, the executive director, Jim Kreider, from your Coffee with Kreider opportunities, as well as the great job he does with the MRTA. So we want to talk a little bit about today a wide variety of issues related to long-term care, some misconceptions and realities about that. We're going to do this from an educational standpoint, kind of talk about some of the issues, the myths, things like that as well. Before we jump into any of this, I want to give Jim a couple of minutes just to share what's going on legislatively, what issues you think this folks need to hear about, Jim.
Well, I thank you, John. I just want to welcome MRTA members to this webinar. It is our goal at MRTA to provide more benefits for our members, better discounts, better products, and more education on issues that are important to retirees. So with that goal in mind, we want to say thank you to Amba, who we have had a relationship now for a little over a year. And I've been very pleased because we're truly getting discounts for our members now. We're getting professional advice for healthcare items and such, and products that will help people have a better life during retirement, which is what it's all about at MRTA. Now, I'll just say this and then I'll close that our goal here at MRTA is to see that every MRTA member lives to be 100. That's it, 100. Well, in order to do that, I read an article that said, if you want to live to be 100, you're going to have more than money. Of course, our number one goal here at MRTA is make sure that pension of yours is safe. Make sure there are adequate cost of living adjustments where you don't get poorer as you get older. But also MRTA provides a place, as the article stated that people need to be involved. They need to have a cause. They need a place to volunteer. They need to see their former colleagues every once in a while. They need to work a little bit. All those kind of things during retirement that will help you live longer lives. So MRTA is here to provide that. We have plenty of opportunities to get involved legislatively, socially, economically. And also part of living to be 100 is to have good health care, good benefits to keep you healthy and well, both physically and mentally. And so we're here to provide that also. So everyone here is going to live to be 100. That's my goal. So we're going to start off today with an educational webinar. We're going to promote lots of educational webinars this year. So far, they've been well attended and popular. So welcome, and I'll turn it back over to you, John, and good morning, everyone.
Thank you, Jim. We appreciate you. We appreciate the partnership that we have with you. Again, my co-host is Bo Carr. He will be manning the chat feature. So if you have any questions throughout this conversation today, anything as far as the education aspect of it, questions that you have, feel free to type it in chat. Bo will stop us if we have some chat questions in there. We'll roll through here. You're going to see this QR code down here on the bottom right-hand corner. You're going to see it throughout the presentation. If you are joining us on your laptop, on your desktop computer, and you have access to your smartphone, all you need to do is take your camera feature of your smartphone, hover over that QR code, and it will pop up a little information box. And you can put information requests in there, give us information that you want to talk about, things like that. We'll have one of our representatives get back to you as well, but you'll see that throughout. And at the end of the presentation, we'll have that as well. So let's go ahead and get started here. We've got a really good group joining us today. So we'll go ahead and get moving through here. Again, my name is John Green. I live a little bit north of Houston. My wife of 31 years is a second grade teacher in the school district that she actually grew up in at the elementary school that she started in. I've got 3 kids. We spend most of our weekends either in Waco or traveling around following the Baylor Bears. But tomorrow I will be headed to Columbia to see my middle son graduate from grad school. at the zoo. So I'm looking forward to being up there and getting into a little bit cooler weather. So enjoyed getting to know that part of the country that I wasn't familiar with before. So I've been in the business working with schools for the better part of about 15 years, Bo for many years as well. And our main goal is to make sure that you understand the value of your membership with MRTA, that you understand what you've worked for all these years, what that value of MRTA relationship is and the membership is. As an educator, you have so many different things that you work for. You've got your pension, which comes on a monthly basis. You've got your health care, depending upon whether it's part of the state plan, major medical, through the school, Medicare. Your school district provides you benefits as well. And that's where MRTA, your association, and Amba step in to support you in all of these things. As a member of MRTA, Jim and his staff are constantly looking out for your pension. Again, that's what you've worked for. That's what the school committed to you, the state committed to you, that you have that pension there in your retiree years so that you can live comfortably as you go towards that goal of 100, to preserve those healthcare benefits that you work so hard for, to connect with your fellow-minded retired educators and active educators as well. So we want to continue to connect you and then offer you those exclusive benefits, discounts, and things like that that provide you as an MRTA member. Bo, I've seen a couple of things pop in here. Do we have any questions that have come in before we get jumping off?
No, I think it's good. I just put a note in there in the chat just to kind of get things rolling. But yeah, if you don't have a pen and paper out yet, grab one real quick. You're going to want to take some notes, and there's some good nuggets in here. So yeah, take it away, John. It's excellent.
Right. Thanks, Bo. The advantages of having MRTA and Amba together is that Jim and his staff have gone over and said, these are some endorsed benefits that are covered, that are available to you, that will cover those gaps that aren't covered by your state or your district benefits. And you're portable, whether you leave the state or not. They're portable if you're still an active educator and leave the school district. You can take these benefits with you. We see many members that say, well, my children have aged out of my benefits. I can no longer cover them, or my parents still need coverage. You can extend your benefits through the MRTA to your family members that aren't eligible for your benefits that you currently receive. And one of the biggest ones, and we're going to talk about this in just a moment, because I see too many teachers that have to leave the profession early, or they have to work longer because they had to take time off, extended time off to care for a loved one. And we're going to talk about some of the situations around that. And this is one of the benefits of having a partnership with MRTA and AMBA, that you don't have to worry about those issues with you as we go forward. And that's through this whole concept of home health care insurance. It's a very broad category. You may have heard terms such as long-term care, elder care, recovery care, short-term care, home health care. It's not designed to be confusing, but there are so many different options that are out there, so many different terminology items to think about. We're going to talk about those today. And our goal in this whole education series is to make sure that you understand what's available to you first and foremost, and two, that you can make educated decisions on things that impact you, that you understand when you get something in the mail, you see something on TV, whatever it is, you understand what these situations are and the need or not, the lack of need that you may have for them. We're going to talk about the myths and facts surrounding this type of care. We're going to discuss the need for long-term care protection, whether you think you need it or not. We're going to talk about the traditional components of long-term care. I would imagine that there are individuals on this call today that took out a long-term care policy several years ago, and I applaud you for that. It was probably one of the wisest investments my father ever did, and I'll talk a little bit about his situation shortly. We're going to talk about some of those traditional components and learn how things have changed and how you can probably put yourself in a better position as well today. We're going to talk about the cost of care. We're going to look at it nationally. Then we're going to drill it down to Missouri. We're going to talk about the cost of waiting, possible solutions, and how to make the most of your endorsed options. Again, you're a member of MRTA for a reason. We're going to help you take advantage of that. So we're going to talk about protecting your future. And that can be through long-term care insurance. It can be through paying for it yourself. Real quickly, Bo mentioned taking out a pen and paper. And so I want you to just write down true or false to these 6 questions. Long-term disability and long-term care are the same thing. True or false? Very few people need extended care. True or false? And if they do, only people over 50 need long-term care. And nursing home confinement is the only long-term care option. True or false? Or, hey, I think Medicare pays for everything. Why worry about it? True or false? Or I should just wait until I'm retired. Well, you may already be retired. Some folks that we talk to are not retired yet. I can tell you each one of these items is false. And there are a lot of misconceptions around what your medical insurance pays for, as well as what Medicare pays for. We're going to dive into that today. Just spend a few minutes talking about that. The big thing, though, that I want to stress, 70% of individuals over the age of 65 will need some form of extended care in their lifetime. And this could be related to a heart attack, to a stroke, to the effects of cancer, could be related to a fall, could be related to something that an accident that they were involved in, or it could be related to just things simply as aging or dementia, something like that. And when I say extended care, I'm talking about 20 days or more of care. So it doesn't have to necessarily be something where you go into a nursing home facility and stay forever. It could be that you need care for shorter periods of time, but extended care is something 20 days or more. If you are on this call and you purchased long-term care insurance, like I've mentioned before, I applaud you. Back in the early 90s, as baby boomers were just starting to think about their retirement years, as America was aging, as those pre-World War II individuals, or they call the greatest generation, those individuals were starting to go into nursing homes and life expectancy started expanding. Families sat around and said, we can solve this problem of care by taking out long-term care insurance. And so throughout the 90s, all the way into the early 2000s, we saw a significant rise in long-term care insurance purchases. Well, what happened after that is people started using this insurance. People started needing to go to nursing home facilities. People started needing care. And all of a sudden, insurance companies were losing billions of dollars. At the same time, Medicare was cutting out services. So you had this crash, for lack of this intersection of increase in need and decrease in support from Medicare. And insurance companies said, we can't continue to support these policies that we sold. So they started raising insurance premiums. May have taken it out at a smaller premium, started raising insurance premiums, and got very strict on underwriting. So now today you have very few people taking out long-term care insurance because it is so expensive, or can be so expensive, especially the longer you wait. And we'll talk about that just briefly. So I want to talk about the historical components of a traditional long-term care plan. And I want to think about it in terms of a hamburger. We're building this great sandwich here. In long-term care, this is just an educational standard setting to help you understand the concepts, the components of it. And then we're going to talk about a little bit more going forward. You have what are called activities of daily living. This is what somebody would be considered as needing long-term care if they can't complete or undertake two of these: bathing, toileting, dressing, feeding, continence, or transferring, meaning getting yourself out of the bed into a wheelchair or out of a chair and walking across the room, that type of stuff. Those are activities of daily living. So that's what would qualify someone to need long-term care. Or we saw a significant rise in cognitive issues such as dementia and Alzheimer's as life expectancies expanded. So think about the buns in terms of this was what would qualify you to receive long-term care if you had a long-term care policy. The meat of a policy is the daily benefit amount. It's the amount that the insurance company will pay towards your care. Then the length of coverage can vary. In the past, long-term care was sold as 5 years, 10 years, or lifetime coverage. So you can see that an insurance company could be paying for someone that stayed in a nursing home facility for years and years and years, and it got pretty expensive. So they started adding what was called an elimination period. And think about this like a deductible on your car or your house, that if you have a hailstorm or a tornado that rolls through Missouri and you have a deductible on your homeowner's insurance for $1,000 and it got damaged, you'd have to pay $1,000 out of your pocket before the insurance would pay for the rest of it. The elimination period in a long-term care policy is based on number of days. And so you had companies that would offer 30-day elimination period, 90 days, 3 months, 180 days, 6 months, or even a year elimination period where the family or you had to come out of pocket $1 for a period of time before you received any type of coverage. In the early days, this was mostly sold with a 0-day elimination period, meaning that the minute you qualified, they started paying. It got to be very expensive. Then on top of that, you got to pick your location of coverage. You could get coverage just confined to a nursing home, or you could get coverage where you also had coverage in your home to help your home get outfitted and retrofitted, or have a home health care nurse come in. Then you had situations where you had inflation protection, where if you purchased a long-term care policy in your 50s, they would add a simple or a compound inflation feature on there that would make sure that whenever you needed it in your 70s or 80s, the $100 a day daily benefit amount you took out was now worth $225 a day, that you had the ability to pay for the coverage and the cost that was future growth of inflation. Then you could add non-skilled services. The last place that most people want to spend their retirement years or their final years that they need care is in a nursing home. If they've got the ability to stay at home and to have a home health nurse come out, or somebody to come cook and clean and change the bed and maybe give them a bath, things like that, and change their clothes, those non-skilled services can be provided in a long-term care policy. So this is the basics that you have, then you can build up with a little bit extra. So this is a historical look at long-term care insurance. But a lot of people still don't understand what extended care means. And when I say extended care, it is care in your home, where most people want to be cared for if possible. It's care in a nursing home, which many people are familiar going to visit their parent or a grandparent, or a long-term care facility, something that's special, maybe like an Alzheimer's facility, things like that. Or there's kind of this hybrid now. It's really a neat opportunity, especially in many urban areas. You have care and assisted living communities are called progressive care, where you may start out there and you receive meals and you've got a community dining area, but you have your own apartment or your own room that you take care of yourself. And as you need more services, they become available to you in gradual increments. And that's what extended care is. So when we talk about all these things, I want you to think about that. And so people say, well, how do I pay for extended care? Unfortunately, most people rely on those first two circles there on the left. They have to pay their personal assets or from their personal savings. So if you're retired and you're receiving a pension, then all of a sudden you have to go to a nursing facility or receive care. Oftentimes that comes out of your personal savings or from your pension. Sometimes you can receive assistance from friends and family. And I will tell you, having done this for many, many years, if you have 5 daughters and they have 5 daughters, you're usually in pretty good shape. But if you have multiple sons and they have sons, they'll come by and mow your yard. They'll come by and clean your trees, but they're not necessarily going to come by and take care of every necessity that you have. So a lot of times you have to rely on assistance from friends and family. You can enter the Medicaid program. We're going to talk about that. It's kind of an option of last resort, talk about how that's impacted. Or you have extended care coverage, which provides all of that. And that way you don't have to worry about those expenses, those concerns, nor the quality of care. And you can decide on where you want to spend that time. No one knows what the future holds in store. As people age, things that we could do for ourselves last week, we're not as able to do for ourselves this week. As we age, the ability to move around, do things that you're used to, cognitive issues pop up, things like that, becomes a challenge. And unfortunately, we see this as well. We see accidents and injuries to younger individuals cause need for long-term care services as well. Whether it be a car accident, a fall, something like that, you can see the need for it as well. Let's talk about some of the common myths. A lot of people think that my health care insurance is going to cover all my long-term care. Or they think that Medicare is going to cover all their long-term care. Or they think that Medicaid and Medicare are the same thing. And sometimes people think, well, I'm just too young to buy this. I'll wait until I'm 2 days away from needing it. and I can buy it. We're going to talk about all those things, explore those myths, take a look at your options and what's available to you. We talked about the services that are provided. We talked about the hamburger. The hamburger doesn't mean that you have to spend time in a long-term care facility, in a nursing home. Sometimes that's the last place that you want to spend. It could be in your own home. It could be in your community, in an assisted living facility, or it can be in a nursing home. I've noticed that in Texas, there are a couple of facilities for retired educators. If they want to retire there, they can go into a community for retired educators. You can also, many churches have different facilities, things like that as well. Bo, do we have a couple of other questions that have popped up here lately?
No, I haven't gotten any questions yet. I did, you had the QR code pop up there on a couple of slides. And so if anybody's having trouble with that in the chat, I did put the actual link as well that you can click on.
All right. I just see the chat popping up, and I want to make sure we don't miss anybody's questions there. I appreciate you monitoring that for us.
Great.
Tell you a little bit of a personal story. A little over 2 years ago, my father was visiting his brother-in-law in Tennessee, in South Carolina, and he had a minor stroke. And my stepmother had to go pick him up, bring him back. He had to have surgery related to that stroke and had to go into a short-term care facility for recovery, and then had to go into a long-term care facility for the last 2 years of his life. He passed away back in October. His care in a good facility was around $6,000 a month for a semi-private room. I am so blessed that he had the vision and the foresight to take out a long-term care policy well over 15 years ago before he retired, because my stepmother, my brother, or I, neither one could have afforded to pay for all of that coverage to have him taken care of. We're going to talk a little bit about that. This is a look at the national cost on average to have a home health care aide come into your house, as skilled nursing individuals, about $25 an hour or $56,000 a year. To go to an assisted living facility, it's roughly $70,000 a year. A semi-private room, $254 a day. Again, my dad was in a nice facility. It wasn't the Taj Mahal, but it was a semi-private room, and it was $6,000 a month, a couple $100 plus a day. Nursing home in a private room can run closer to $300 a day or $123,000 a year. Look at it a little bit closer in Missouri. Now, I would encourage you, write this down. You can go out to genworth.com, and you see that genworth.com down there. There's a cost of care button on that website. You can plug in your zip code, and it will give you what the average cost is. And you can see here for home health aid, it runs anywhere from $4,000 a month to $4,500, $4,600 a month, depending upon where you're located. Assisted living facilities can run anywhere from $38,000 on up. Semi-private room, nursing homes. So you're looking at $38,000 to $90,000 a year, depending upon your location, the type of care that you need. And I did notice there were some places that you could have adult daycare options if you needed to go just for the day to have someone take care of you, but you came home at night. But then other parts of the state, the more rural parts, there were not adult daycare opportunities. So I encourage you to go out there, take a look at genworth.com, understand the cost of care in Missouri, what your needs are when you're talking about it for your parents, for yourself, along with your family. Now let's talk about how you pay. You can use your savings, and Bo and I have done this for a long time, where we see the biggest challenge with families. If they've got saved up assets, if they have saved outside of their pension, if they have land, if they have family land, things like that, they have funds for this, but they don't have access to those funds right away. Care starts day one. The funds may not be there right away, so you have to use your personal savings. Sometimes you have to sell your assets, and you may not want to sell them. If the stock market's low, you may not want to sell them. You may not want to sell your family land because we were always going to retire on Lake of the Ozarks. You know, there's all these different things that you can do. You may not have to do that. And sometimes when you liquidate those assets, it triggers taxes, loss of future earnings, things like that. Some folks will tell us, well, I'll just rely on Medicaid. I will tell you, Medicaid is truly a last resort for people with limited assets. You have to spend down those assets significantly to qualify. And most states will do a look back period of 5 to 7 years. So you can think, well, mom needs to go into a nursing facility. Let's go ahead and transfer all the assets to the sons and daughters. It's a very, not tricky thing, but it's something that you have to do. But if you have to do it right away, the state's going to look back and say, oh, you were trying to hide your assets to have them protected so you can go on Medicaid. And the state, I know in Texas, I don't know about Missouri, the state of Texas is strongly going after reimbursement for those assets. Now, they're not going to send you and tell you you have to sell your house. They're just going to send you a bill and say, this is how much it costs to take care of your family member. And some families have the money, some families don't after they've passed away. The state will seek that back. In the facility that my dad lived in, right outside of Austin, in a really nice community called Marble Falls, there were 3 wings in his facility. The first 2 wings were for people who were private payers, meaning they had long-term care insurance or they paid with their own money. It had more nursing staff. Those individuals had more physical therapy, things like that. Then the third wing was a Medicare wing. That Medicare wing, while they got quality care, it didn't have as many aides. It doesn't have as many skilled nurses on that wing as well. So again, it doesn't make sense to me for you to work all your life to have somebody else determine what your care is. So let's talk a little bit about Medicare. And I really want to hit on this really close, and we'll answer some questions here in a moment. Medicare, people think Medicare is going to pay for my long-term care. Medicare has provisions in there that will pay for your recovery in a skilled nursing facility, okay? Think about, mention my father, when he had his stroke and had to go in and have surgery for carotid artery in there and clean that out. After he got out of the hospital, they moved him over to a skilled nursing facility, and Medicare paid for that for the first 20 days, okay? And these hospitals know this. They know that after 20 days, you're going to have to pay as an individual or they're moving you out. So after those first 20 days, you're going to have to pay a co-insurance clause of $185 a day. Then after 100 days, Medicare stops. So if that's $200 a day to stay in that facility, Medicare pays $15 and you pay $185. Then after 100 days, that stops. So Medicare doesn't solve everything in this. Talk about recovery, skilled nursing care, and the term stay in a hospital. We're going to talk about here in a few weeks about Medicare, but I want to share with you one thing that Medicare has done lately that has changed this dramatically. Hospital observation status. Not all hospital stays are considered inpatient care. So if you have to go to the hospital, you could conceivably spend 2 or 3 nights there and not be considered a stay. You could be in observation status. And that is an outpatient category that wouldn't qualify you then to receive any type of long-term care. So it's very, not say convoluted, but it's very tight window by which they have this. And as Medicare cuts take place, hospitals are having to respond, and Medicare can go back and take money back. They can penalize hospitals for not doing things properly in terms of readmittance and things like that. That's why this observation status is here as opposed to a stay. Bo, we've got some, I see a lot of orange popping up here. What kind of questions do we have?
Yeah, it's good. I've got a couple of questions about will this information be available after the webinar? And the answer is yes. And so you'll be able to find that on the MRTA website. The other question I thought was good. We talked about elimination period and some of the other factors that go into long-term care policies. What about a waiting period? If you were to enroll in something today, how does that work as far as how soon you can use a policy like this?
Okay. That's a great question. We'll touch a little bit on it as we go on, but just in general, The nice thing about having endorsed benefits through MRTA and Amba is that we have, and MRTA have screened these companies, and that once you're approved, underwritten, you qualify day one for coverage to be available. Now, there are some provisions in there. If they didn't do their underwriting well enough, and maybe you hid some medical records, and they do pretty exhaustive depending upon the actual the actual type of product or policy that you purchase, that may give you a refund of your premium, but because you go in day two, something like that. But all these things, depending upon, again, not talking about elimination period, because you can just determine that, but availability of coverage is the minute it is covered, it is policies put into force. There is no waiting period at all, and that's a big thing that, as Amba to MRTA members and MRTA endorsing these benefits, that was a big thing we wanted to make sure that it was not an issue for members. So that's a plus for being with MRTA. And we'll talk about it a little bit more, but that's a great question. Great question. All right. So we've talked about you paying it yourself. We've talked about maybe your friends or your family come over and taking care of you. We've talked about possibly Medicare, Medicaid paying for some of this kind of stuff. Another solution is there are long-term care policies. They help supplement your out-of-pocket expenses. They pay for those long-term care expenses. With my father, they paid for everything. It was great. My stepmother didn't have to worry about a thing. She was able to even have an advocate for her, that if she felt my father needed certain services to be able to swallow better, things like that, they would pay for an advocate that would help get those services done for them. My father had a couple of falls where he'd have to go to the hospital to get taken care of, and then he would come back. Well, many long-term care policies have a bed reservation provision that would make sure that my dad's bed would stay there, that they wouldn't give it to anybody else. There is such a demand for good, skilled long-term care facilities that if they don't think you're coming back, they'll give it to somebody else. So again, this protects your assets. It helps you stay connected the way you want to. If my stepmother could have kept my father at home, she would have kept him at home. She couldn't physically move him. He would get up in the middle of the night as part of his dementia, and she'd find him repairing electrical equipment. He doesn't know anything about electrical equipment, so she had to have somewhere to go. But again, when you've got a long-term care policy, you can take care of things yourself. You can decide how you want this taken care of. The stay-at-home benefits are huge. Again, you can have someone come in and help with the cleaning, meal prep, bathing, things like that. You can have a skilled nurse come administer medication, physical therapy. It can also provide special equipment like walkers, wheelchairs, home modifications. This is huge. If you can just have a ramp built in your house, widen some doors, put in a new bathroom with some pool bars, things like that, that's the best way to go. A good policy will take care of that. You can use that money in the policy however you want to, depending upon the way you set it up. So again, that's what I like about today's policies. You can cover yourself and take the money any way that you want to use it for yourself. You have several choices. Again, this is so customizable. You can take cash, meaning the first day you qualify. And many of these companies, the insurance policies, you may have, like with my father, when he had his stroke, we didn't know that he could never go back home after that stroke. Well, the clock starts the day one of the stroke, not 30 days in when we can't decide if he can come home or not. So it goes back to and looks back to the minute that event happened, that he lost one or two of those daily activities of daily living. And it starts that clock there. You can use, again, the expenses, the money any way you want to. You can have home health benefits. You can have nursing home benefits. You can get reimbursement. There's so many different features that you can receive in your policy and your benefits. But I can't stress this enough. As you age, qualifying for long-term care becomes more difficult. You see these numbers out here. The younger you are, the easier it is to qualify for. The older you get, the harder it is, because it could be related to your health. It could be related to the medications that you take. Dementia, they'll ask questions, things like that. They will ask you questions on an application. What's today's date? Who's the president? What's your name? They'll ask you those 6 or 7 questions later. And if you can't remember or don't know or stutter, stop a little bit, they will deny the application. So it becomes difficult to qualify the older that you get. And the cost of waiting gets more expensive as well. This is just some sample coverage out there. The annual premiums for these policies, how much would be paid, and the cost of waiting over a 10-year period can be pretty sizable, the cost of a car. There could be other options, and this is really kind of the point we want to point out, because long-term care itself, the insurance coverage for long-term care is important, but it is expensive and harder to qualify for. MRTA and AMBA have stepped up to the plate and found some different coverages out there that can maybe fill some of those gaps. You can get shorter lengths of coverage. You can get a 1-year policy or a 2-year policy. You can get a policy that can be just a few dollars, $10, $20, $30 a day with inflation protection on it. You can pick a set amount. There's much more flexibility in the amount that you can receive per day. And you can change the coverage. If it's in a nursing home facility, it's X amount. If it's at home, it's a different amount. So you can change those up as well. The elimination period. This is a biggie. We deal with customers who took out a long-term care policy through the school when they had the opportunity, and they've kept that policy, and I applaud them. But it has a 90, 180 day, a 365-day elimination period. So they've got to come up with that first $6,000, $8,000, $10,000 out of their pocket before any coverage starts. We can provide coverage that covers that elimination period for a short period of time. Very inexpensive, very good coverage. Make sure you don't have to go spend those assets down right away or tap a bank account or sell something right off the bat. You can take care of it that way. And location-wise, if you want to stay at home, we have policies that do that. If you have an accident and say you need coverage for a short period of time, maybe a hip surgery or break your hip and you have to have 6 months of care at home. Well, then after 6 months, you don't need the care anymore. But then 2 years down the road, something happens. We've got restoration of benefits policies that would give you that coverage right back again, as long as you're paying for it. So again, it protects where you want to be. And you can select whether you want skilled, non-skilled services, so many different things out there. That's the beauty of today's opportunities for you, or options. There are so many different things out there that lessen the cost up front, give you more control, and give you more peace of mind that you can, if you need it, that you've got protection there for you. Everyone's situation is different. We can customize based on your needs. At Amba, we're here to help you tailor the type of care policy that you need. If you want to use that QR code, again, you can take your phone, and we've already had someone do that as well. You can take the feature on your phone, that's your camera, open it up, hover over the QR code, much like we do restaurants in the time of COVID, and it will pop up a little bitty form. You can put your information in there, select what you want to talk about. We'll have one of our representatives come out and talk to you about that, or call you on the phone. Can take care of your needs that way. We'll even send out this as well to all of you on the call today. That way, at your leisure, you can look at it, think about what you may need, and have conversation about that. So I'm going to open it up for questions here. Again, the QR code is on there. If you don't have the ability to do with your smartphone, you can always email me at john.green, like the color, at amba.info. And I will be glad to answer questions or also get you in contact with someone in your area. So, Bo, I see some orange blocks blinking up there. What kind of questions do we have?
I think you're mostly seeing me right now. Type it in. I put if you have trouble with that QR code, I just put a link in there so you can click on it there, and then your email as well. Here's Charlotte just asked a question on the sandwich slide. There was a cognitive aspect and just missed that. Can you clarify? Because I think that is something different. That
Absolutely. That's a great question, because this is something most long-term care policies, that bottom bun, that activities of daily living, you have to have lost the ability to do 2 of these. So you can't bathe yourself and you can't dress yourself, or you can't feed yourself and you can't get out of bed. You lose two of those, the benefits activate. Or, and as you say, use the word or, you have a cognitive impairment such as dementia or Alzheimer's. With my father, it was not the stroke that caused him to need to go into long-term care. It was the dementia that caused him to need to go into long-term care. So that one cognitive impairment was what caused that. So, and that is where we're probably seeing in the long-term care arena one of the biggest growth issues, because individuals with Alzheimer's may be able to do all the activities of daily living, but they can't be left alone. And some of the people that I met in my dad's facility, many of them had Alzheimer's. They had been there 3, 4, 5 years. You know, there's no stress on them or anything like that. And so it's important to understand the two differences. That's a great question. I hope that answered that for you. Super question, because there's two different ways to qualify: activities of daily living or a cognitive impairment.
Yeah, very good. Yeah, that's a great question. And just got another one in here too. Julie is asking, you had mentioned, I think, in some of the older policies, we used to see a lot of those lifetime policies available. Is that something that you still see in the marketplace at all?
If you do, they're extremely expensive. The riders for inflation protection are extremely expensive, and the qualifications are difficult. Oftentimes what you'll see in that is the older you are, they'll stop offering that type of policy. So depending upon your age, they'll stop offering those types of policies, or they'll get stricter on the underwriting. I haven't run across one in a long time from a new standpoint, but if you have one that has lifetime coverage, hold on to that as long as you can, pay the premiums, do whatever you can, because they're golden. But that's a real good question, but I haven't seen many that are out there right now.
Perfect. I got a couple other questions popping up here. Well, just to follow up, Julie just asked, so what length of coverage do you recommend getting then if lifetime is not necessarily attainable or available?
Okay. The average stay for a long-term care facility patient for a male is 8 months. The average stay for a female is 2 years. My recommendation, again, I'm not a doctor, but just have seen this, is to find something in that 2 to 3 year period that has home health benefits with it as well. Because what usually happens is it takes a while for the family to finally say, I can't take care of dad anymore. We need to be able to move into a facility or bring a nurse into the house. You've got that ability there for that transition. My mother had to put her father in a nursing home facility, hardest decision she ever made. Difficult for her. My grandmother couldn't take care of him. She wore herself out and actually passed away before he did because she was so worn out from taking care of him. So if you can find something in that 2 to 3 year period with a home health benefit, that's my recommendation in that.
John?
Yes, sir.
Can I comment? My wife and I just about a year ago purchased a in-home care policy from Amba. And it's just like you described, in-home care, which is my goal, is to be taken care of at home. But it also has a provision for some nursing care too. And so I'm very happy with it, and it wasn't that expensive. And so I guess that's an endorsement of what you just said. But yeah, I've got it. Yeah.
I appreciate that, Jim. It gives peace of mind. Again,
yeah.
The coverage my father had, we were so appreciative of, because again, my stepmother, she was still working and she couldn't have afforded it even at that point. My father had good savings and all that, but my stepmother can live in the standard that she attained now, even after he's passed away, because she didn't have to spend $144,000 on his care. So,
and may I say this again, you've said this several times, but every person is different. Every family is different. And so the beauty of these plans is that you can sit down with somebody you can trust. We hope and we know that MRTA is going to endorse people you can trust to talk to. They're not high pressure salesmen at all. They'll sit down with you and see what you would like and then make a plan that works for you. So the point I'm trying to make is everyone's different. You can't really go on a webinar and say, okay, I want that plan. You've got to talk to somebody and voice what you think the future holds for you. Yeah.
Exactly. And that's the whole point of this education series, is not to be a conversation about prices and coverage and things like that. It's to be about educating you on your options and what your needs are. And we have several more educational opportunities coming up. On the 20th, the 25th, and the 3rd, we're going to talk about emergency medical transport. We're going to send you an article if you sign up beforehand. The cost of emergency medical transport in Missouri is phenomenally expensive. We're going to break through all the myths and the realities of that. We're going to talk about Medicare. We touch on it a little bit today. We're going to talk about it more in depth on the 25th. And then with summer kicking off, we're going to talk about all the fun stuff, all the discounts, the benefits, all the travel stuff. The world's opening back up on the 3rd. These are free to sign up. Be on the lookout. Sarah does a great job communicating these. We limit these to 100, so we make sure that we have enough space for everybody to get questions answered, things like that. So jump on. Check out the calendar that we've got for the rest of the month and going into June. And please tell your friends about this. Tell your coworkers who aren't MRTA members, your former coworkers. This is why you want to join MRTA, to take advantage of all this education that's out here. Most of you are teachers, you're lifelong learners. What a great way to continue your education. But tell others about this. Tell others about the series and tell them about MRTA. So, Jim, we thank you for the opportunity, for the time to be here. And Bo, are there any other questions before we wrap it up today? I know we've gone a little long, but we've got some great questions.
Yeah, no, I think, and I can probably handle these last couple of questions. And thank you everybody for sending these questions. And I'm looking off on a screen on the side here. And so we got a couple of questions that came in just about, can we get a copy of these MRTA insurance policies, just to kind of see. And so the best thing I would do for anybody on this call is to say, just connect with us. And what we'll do is just a quick kind of get to know you conversation, but just there are 4 or 5 solutions that MRTA has provided for members. And so it helps us to be able to kind of put you in the right place of what's going to help fit you. But yeah, there's no obligation. So we're happy to meet with you, kind of run some prices, give you a ballpark so you kind of know what you're working with, and let you digest that and talk to some other folks. We got another question also about VA opportunities and VA homes. I have an uncle who's going through that process now in the state of Alabama, so I'm familiar with it. And so Gwen, I would suggest, and anybody else who has VA benefits from a military career, yes, we can give you additional information about kind of what those coverages look like and whether some of these things will be worthwhile for you as well in a VA situation.
Exactly.
All right, everyone. Have a good day, good weekend. Stay well, get your shots. And I'm going to say this, you can't have these benefits if you're not a member. So you need to join us. And we have strength in numbers, and we've got 1 week left in the legislature. I cannot tell you what will happen. It is a mess over there right now. They're fighting amongst each other. They're trying to rush the budget bills through today. But next week is going to be a zoo. So stay tuned. Stay tuned, MRTA members. Stay tuned.
Thank you, Jim. We appreciate you all. Have a great weekend. I look forward to being in Missouri this time tomorrow. Y'all take care.